Joining us here in our newsroom, we have Dr. Bindia Gandhi. She is an integrative physician from Georgia. Hello.
Hi, thank you for having me today.
Great to see you. So people are stressed these days. That's no surprise. And today we are going to be talking about immune health. Specifically, I understand there's some new data about health in general, the health of our country. Tell us about it.
Yeah, so a recent survey revealed that more and more Americans are actually concerned about their overall health and their immune system. And actually, Americans feel that their immune system has worsened during this time. Two out of five Americans actually feel that their immune system has weakened because of the pandemic. And that's because, we're not eating as well as we used to. We're not as active. We're more sedentary. We're not sleeping as well. And we're so stressed. So all of these things actually contribute to our immune system.
Mhm. Well, it's interesting because these habits, if they were more positive or in the other direction, they would actually help with our stress, correct?
That is correct. So, when we're eating better, when we're getting good quality sleep, we're exercising, we're managing our stress, when we are doing some of these things along with taking a good immune supporting supplement like emergency, which has vitamin C, it's got zinc, it's got manganese. All of those things help support the immune system. Other things that help support the immune system are B vitamins because they help maintain metabolic function. So, taking a daily supplement along with these lifestyle practices really helps support and maintain our overall wellness and our immune system.
Do you recommend a supplement if someone is not deficient? I mean, if someone just has proper levels of these vitamins. I mean, do you have to be deficient to take these, or do you recommend one every day, regardless?
So I recommend every single person take a supplement like emergency every single day, all year around, to help support their immune system, along with maintaining a healthy diet and lifestyle.
hmm So we hear the words boost your immune system, optimize your immune system with all of the examples that you just gave, but it sort of ends right there. So what does this mean? What does this look like? Okay, we need to eat healthy. What does that look like specifically?
So great question. When we're talking about nutrition, first things first, we want to make sure we're not eating a lot of processed foods. We want to make sure our diet is clean as much as possible. So focusing a lot on lots of vegetables and fruits, minimizing alcohol, minimizing sugars. Those are the simple things that I recommend when we're talking about boosting your immune system from a nutritional perspective. Now, when we're talking about supporting your immune system in other ways, this is making sure you're getting good sleep, right? Ensuring you're getting good quality sleep. You're also exercising, you're maintaining social support because during this time, because of the pandemic, a lot of people feel isolated. And this is why many people are a lot more depressed because of this. And the other thing that we need to also do is we need to limit our screen time. We're on the phones all the time. We're also, in front of the computer. So let's minimize our screen times. And then taking a daily supplement. All of these things can help support our immune system.
Mhm. Well, Dr. Gandhi, do you have recommendations in terms of exercise? Is there a specific amount that people should be getting per day, per week, or is it just everything helps?
I really recommend a very comprehensive approach. So we need to do everything in conjunction with nutrition and exercise, as well as managing our stress levels and taking a supplement. But when it comes to exercise in general, if you're not someone that's exercised or that hasn't, gone for walks in the past, it's unrealistic for me to say, go ahead and now go walk for an hour every day. So start small, be realistic, and work your way up towards your fitness goals.
Mhm. People are going to find that encouraging, thinking that they need to just go all out. If they don't meet the recommendations from the American College of Sports Medicine, let's say, every little bit counts and you'll get there. What do you think?
Yeah, exactly. I'm all about small steps, incorporate one healthy lifestyle and one habit at a time. Once you're comfortable with that, add another element. And
Mhm.
of course, again, like I said, these are things that we want to do every single day, not just because we're in a pandemic.
Mhm. Exactly, right. Not just it's something that is sort of year round regardless of the time, but I mean, especially this time since we're sort of suffering in this way. And Dr. Gandhi, let's circle back to sleep. There's a certain amount, I would say, is it 7 to 9 hours? Um, what is the best time for when do we get our best sleep?
So always encourage everyone get about 7 to 8 hours of good quality sleep, right? So, you want a couple of things that we can do is, at 6 p.m., I start minimizing I should say not minimizing, but dimming my lights in the house to kind of improve my circadian rhythm and to kind of help melatonin production. Now, the other way that we can do that is by limiting our screen time, right? So if we cut out the computers earlier or our iPhones, that'll also help improve that melatonin production so we can sleep naturally.
That's really interesting. Decreasing the dimming the lights because we naturally produce melatonin, but there's also this supplement of melatonin. What do you think about that?
Yeah. So my recommendation for everyone is to try lifestyle habits first before they try any sleep aids. From an immune perspective, I really recommend that everybody take emergency, which is a daily supplement that helps support your immune system along with these lifestyle practices so you can support your overall well-being, lifestyle, and immune health.
Mhm. So you mentioned that there are a lot of behavioral changes very difficult, especially if you've gone to maybe perhaps, maybe caring about I don't want to say caring, but having a prioritizing your health and then suddenly being in this slump, or maybe you've never even thought about it until now. So how do we get people to get from being aware that we need to change our habits, understand the implications if we don't, to actual behavioral change? I mean, you had mentioned one thing at a time. Is there one thing that you would recommend doing first, such as sleep, try
So
to eat better,
that's
or
that's such a great question. Yeah, so such a great question. My recommendation, honestly, is to start small, have realistic expectations, but be consistent. So maybe this week you work on going to sleep earlier and focus on getting good quality sleep. Once you've mastered that, or you think you're good at it, we add the other elements. So maybe that means we're going to walk 15 minutes a day. Once we're comfortable with walking 15 minutes a day, we can up it to 30 minutes a day, right? Once we're comfortable with that, we can add another element. Maybe that means we're focusing more on our diet, or we're focusing on stress management. But it's a combination of these things that really keep us healthy along with taking a good supplement.
Mhm. And then sometimes, let's say we forgot to take our vitamin, we didn't walk as much as we wanted to, and we get up the next day and we're feeling bad about ourselves. That's probably not the best thing.
No, it's not our best. It's not. We shouldn't feel bad about ourselves. Every day is a new day and it allows us to start over again. So it's actually a good thing. So, again, be consistent, start small, and every day, there's always room for improvement in your immune system and your overall health.
Wonderful. Well, Dr. Gandhi, great to have you on. It's going to help a lot of people. Thank you.
Thank you for having me today.